Okay. Okay, so I'm not gonna, I don't know whether I should read this or not, okay. I'm calling to order the Board of Health for Tuesday, July 15th, 2025, in the Town Hall in the Don B. Griffin Room. As required by law, the town may audio or video record this meeting. Any person intending to either audio or video record this open session is required to inform the chair. Meeting is called to order. So the first thing in order of this is to do the reorganization. It came to light that, based on the charter, we shouldn't have been doing this until the first meeting in July. So we're going to go through this again. So I'm going to nominate Kevin DuPont for chair.
Aye.
Second.
Second.
Okay.
Sorry, second.
Okay, vote.
Then aye.
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 All right. And I would like to nominate Ron for vice chair.
Vice President.
Vice chair.
Seconded.
Okay, vote.
Aye.
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 Aye. And I guess we're going to roll in Pam again, since she's not here, and nominate Pam as the clerk.
Second.
Vote.
Aye.
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 Okay. So we're back to where we were. All right. Public comment, so, okay, there's no public comment, so you can take it from here.
Well, we have, under public comments, we have the presentation by Nicole Hallis from Crescendo Consulting.
Is she on? Oh, good.
Hi, Nicole.
Good evening. I would like to request the ability to share my screen, please. Is that possible? Thank you.
Which one is she?
All right, let's get this set up here. All right, so are you looking at a presentation right now?
Yes.
Yes.
Perfect. Okay, well, wonderful, everyone. Good evening. Thank you so much for this opportunity to be here this evening. As Carrie mentioned, my name is Nicole Hallis. I'm a research manager with Crescendo Consulting Group. And I've been working with the Carrie and the Harwich Health Department and some other local partners to help pull together what we are calling a community action plan, which I'm going to present to you just briefly tonight. So what we're going to be talking about is just background of why and how this plan was created, options to consider going forward to make the plan actually actionable, and some highlights of the plan itself. I'll then finish off by talking about why this is so important and some potential next steps. So first of all, to put this into some perspective, why was this plan created? This work builds off the Lower Cape Community Health Needs Assessment that was completed last year. And that assessment involved residents and providers across Brewster, Chatham, Harwich, and Orleans. And it surfaced some shared concerns around things like disease prevention, mental health, housing, transportation. And in Harwich, the health department wanted to take information about those regional needs and really drill down. What does that mean for us? What's already in place? What might be possible realistically if local and regional departments and partners work together to address some of those needs? Because it's all well and good to figure out, okay, this is what our needs are. But the point of this plan was to really take it a step further. Now we know what the needs are, so how do we go about addressing them? And the plan focused really on concrete action items, not just ideas to really guide that work, always thinking about what can actually be done here. So over the last few months, we gathered input from a range of town staff, local organizations, community partners, some regional representation through interviews, a survey, and a working group that met regularly to help shape the plan and provide feedback in real time. So to really brainstorm, what do we have, what can we do? And incorporating that boots on the ground input means that what we've developed here in this action plan, we hope reflects a deep understanding of the community, the barriers that people face, and again, what those realistic actions can be. And importantly, again, our focus was not on reinventing the wheel. It was really about capturing what's already happening, where there are gaps, and then what actions are within reach. So to actually go about making this plan work, if the town does choose to pursue any of the ideas in the plan, there are a few common ways to get started that you'll see across the plan. And these came directly from funding notes and planning conversations, because as I mentioned, it's all well and good to have these ideas, but we really tried to focus on making them successful. So one way to do that is to leverage what's already working, either in Harwich or nearby towns, not starting from scratch. Another is to apply for available funding, programs like the Public Health Excellence Grant, opioid settlement dollars, or even federal grants, because we all know that funding can be a huge barrier to starting any of these. You could have the best idea, but if you don't have the funding, might as well forget it. So we know that's a huge, huge issue. And in many cases, there's a chance to stretch town resources creatively, using interns, shared staff, or regional collaboration. Harwich does not have to do all of this alone. And for bigger initiatives, which we did include a few of these in the plan, it's perfectly okay to phase things in over time. Starting with a small pilot or planning effort, there's really no need for everything to happen all at once. So it's important to keep these strategies for success in mind while I go through the plan. Some of these do sound like big initiatives, but just keeping in mind that you don't have to do it all at once. There are these other strategies in place that can help be successful. So thinking about the actual structure of the plan, we needed to figure out how to organize it in a way that, again, makes these actions accessible and manageable. To do that, we divided this into 3 sections to make it easier to digest. There are some foundational ideas for townwide infrastructure and coordination. Second is some immediate action priorities, so those have shorter term options, like 1 to 3 years or so. And those are really centered on the needs that are having the biggest impact in the community, but are the most realistic to address. And then thinking about transformational initiatives, that focuses on the needs that will require longer term plans. They take more time, funding, partnerships, and you'll see when we get there, there's no way for one town or really even one region to solve some of those big transformational initiatives alone. So that's why we divided it like this. So starting with that townwide infrastructure and coordination, those are the real foundational ideas. Relatively low-cost strategies that help other efforts in this action plan run more smoothly and cut across the other areas that I'll talk about next. For example, a few folks mentioned that the town has resources in place already, but not everyone knows about them. So improving how information is shared, both digitally and in print, it's a relatively simple initiative that would really have a big impact. In the same vein, there's interest in creating a simple, up-to-date resource guide, so residents know where to turn when they need help. Another idea in this action plan is a small resource corner in a central location in town, where people can grab brochures or meet with a rotating staff person. And down the road, there's an idea of looking at whether a more unified health and human services department might help reduce some of those silos. But again, that's something that would take a little bit longer term planning. But again, something that might help solve a few of the issues that we'll talk about next. So first up, we looked at these immediate action priorities, which I talked about are those more realistic to address in the near term. Those categories, as I mentioned, were shaped both by the Lower Cape Needs Assessment and local conversations. We organize them around 6 categories: mental health, healthcare access, disease prevention, public health education, substance use and opioid outreach, and food insecurity. So some examples of the items in this action plan include things like continuing to build on the peer mental health ambassador model, which has been shown to reduce stigma and reach people who might not seek formal services. Also expanding the volunteer medical driver program through the Council on Aging. It's already doing great work, but they're definitely stretched thin and could use additional support. And partnering with the county or VNA to bring mobile screenings and vaccine clinics to familiar locations. Other immediate action priorities addressed in the plan include supporting public health education, especially around vaping prevention, youth outreach, using tools and funding that largely already exists. And on the opioid front, supporting harm reduction initiatives, providing education outreach community-wide. And in terms of food access, an area where Harwich does have resources, suggested actions include continuing efforts like the Family Table Collaborative Partnership and growing the People's Garden, which already has momentum. And then we look at the transformational initiatives, which, as I mentioned, these are big systematic issues these are not necessarily specific to Harwich. Many of these are nationwide problems. So we organize these around 5 different areas: housing, childcare, jobs and cost of living, transportation, and activities for youth. The actions here will require more coordinated efforts, recognizing that one town cannot solve all of these problems alone. For that reason, think of these ideas as longer-term possibilities, options the town may want to explore over time, and suggestions about how to go about achieving them. Things like providing clear housing information, strengthening emergency assistance programs, or revisiting zoning that allows for more flexibility. For childcare, expanding infant and toddler care through regional partnerships. And to address jobs and cost of living, the action plan talks about increasing awareness of local relief programs. Again, that's a relatively low-hanging fruit item that would potentially help positively move the needle. And also just sharing data on what it actually costs to live in Harwich. I'm sure I don't have to tell you all that it is expensive to live there. And that can really be a barrier for a lot of people for their overall well-being. And then when completing the needs assessment last year, transportation came up often as a barrier in people's lives. To help address that issue, actions in the plan include supporting driver's ed for teens and exploring how to expand regional ride options. And finally, when it comes to youth, folks talked about just simply surveying students. Ask them about what they actually want to do to really help focus and target funding. Supporting access to extracurriculars, and longer term, thinking about a more robust youth programming space. It is worth pointing out, why does this matter? That many of these needs are connected. Food access ties into health. Healthcare ties into disease prevention. Transportation affects just about everything. Getting to appointments, getting to work, getting your child to childcare. So even a small improvement in one of these areas can create a ripple effect in others. I always like to say that if you can move the needle on one of these, you're really moving the needle on all of them. And that's why this plan is meant to be flexible. The town doesn't have to take it all on all at once. It's a roadmap, and it's okay to start small. Because again, addressing one of these needs has a broader impact here. So looking at some next steps, the report will be shared publicly, and town leaders, including you all, can decide what's worth pursuing now, what needs to wait for later. Some steps are ready to go. Others might take longer or require more funding. But the important thing is that there's now a shared tool to help guide those conversations and really serve as that starting point. So thank you again very much for your time, for all the work that you're doing to support the community. I'm happy to answer any questions or provide any support needed as the town works to tackle some of these actions.
Thank you very much. Thank you very much. I'm going to start down there with Janet. Do you have any questions or comments?
I don't have any questions or comments, thank you.
Kevin?
No, nothing from me. Thank you for the, time for collaborating and putting all this together. Look forward to working in the future.
Nope.
Okay, I have some questions and comments. I did take part in some of the initial interviews that you had, and I have some questions, and I think all of this stuff is really great. I think it's a very large undertaking, and I guess my questions are, and this is, I don't know whether you can share what are the, maybe what the other towns have done. Where does this start? Who's going to get this ball rolling? It can't be strictly the Board of Health, because they're going to fall under the Select Board. So where do we get this, how do we get this ball rolling? If the Select Board doesn't buy into this and agree that the things that are listed here are necessary for the community and would like to see them done, if we can't get them to buy into it, I look at the Board of Health, and some of the things that maybe the Board of Health could or should do would be almost impossible without additional help and support. So I'm not asking whether it's your responsibility, but how do we get this to the attention of the Select Board and organize it also with other communities? In other words, a lot of this could and should be shared, but that, I don't see how the Board of Health can do that. I see that as starting with the Select Board and working down, so I'd like your thoughts on that.
Absolutely, Carrie, I'm happy to kick off that conversation if there's anything you'd like to add. We are presenting this information to the Select Board on Monday. And really the idea here is that we've organized this plan to be as easy as possible to support buy-in. Really starting with some of those ideas that they're low-hanging fruit, they're low cost. It's going to be hard to say no to developing some sort of resource guide to help people find resources. And then the idea is once we get buy-in on some of those low-hanging fruit options, that additional buy-in will come. And we've also framed this plan to really, really point out that we're not expecting Harwich to do all of this alone. There are options to build on regional initiatives that are already going on. And Carrie, I'd be happy to, if you want to jump in at any point, just to talk about how you envision this going, because you really are the leader of this plan.
Yeah, so a lot of this is for like Nicole talks about, the low-hanging fruit, the outreach, the communication, the resource guides. Those are all things that we can manage currently within our budget, within our resources. Some of the bigger items.
Excuse me, including those, they talk about those resource guidelines.
Yep.
Is that something that is going to be a written resource guideline?
So we're working on a pamphlet right now specifically for the opioid use stuff, so that was kind of a first need that needed to be met. So we have an intern from DPH, Masha Craig, that's working with us this summer, and she's building that resource guide for us, and we plan on taking that guide and building off of it. So anytime we have an opportunity to apply for an intern to help us support some of these things that we don't always have time for, we are looking and exploring every option that we can. Some of the stuff that we can do with staff time. Some of it we can do with just the outreach, like attending the farmers market or the 204 market every week and giving out public health resources and information.
Are you going to be working or presenting this, let's say, to the Select Board? It's not just what she's going to do, but what you're going to do is say, hey, because you can't do it all yourself. I mean, I would think there's other boards or.
So This last budget cycle, we tried to get a Health and Human Services division created because that would help free up time for the health department to function and then create a position that kind of forces collaboration through a few other departments, bringing them together, and then having somebody who can advocate more for the things in this packet.
And I think that was kind of, when, on here it says explore forming a unified Department of Human Services.
Which we tried to
To
do, and
do.
we will try to bring that back again,
And-
but that requires budget and support, and it's not an easy tick when they want, you know, no increase in budget or no enhancement services. So, we'll keep at it. We can't make any promises. We can bring the information. We're also trying to work more collaboratively with the Lower Cape as a region, so Orleans, Brewster, Chatham, and do more together so we can spread a little bit more resources further because we are so close.
Is it a possibility, and I don't know how you would do this, but to get the community itself more involved as far as letting them know if we could expand the Department of Human Services, what that would mean for them, and have them maybe guide this into the select board to try to get additional help. So
Yeah.
how would you go about outreach to the town as to, you know, if we can do this, this is what we can provide to you, this is how much it would help you, help us
I
get
think-
this to the select board.
This is an opportunity to do that. The select board meeting is an opportunity to do that. And when we ask for the enhancement of services during our budget cycle, that's an opportunity to do that. I don't know how much more beyond getting the community involved with supporting health services
Yeah.
is
And I think that.
realistic.
I think
It's always
that's-
been an underfunded
I think that's our
department, so-
weakest link. I think that's our weakest link, is being able to get that out to the public, to get the public to help support what you want to do in order to get these services
What,
provided.
what we really want to do, and our goal has been, is to build relationships with the community and get out there and be a positive face, because I think health departments notoriously are regulators, so we have to constantly tell people no, or,
Yeah.
you know, that you're doing something wrong, or we have to penalize, and it's nice to have a different avenue to approach people, so we have been trying to do a lot more public outreach with the programs through the garden, the programs with the fridge, the programs at the market, and just try to engage people in a different fashion,
Maybe
sharing
more,
information.
maybe more presentation or comments at the Board of Health, the Board of Select meetings. You know, that this is what we're doing, you know, we're looking for input or help from the community, and maybe more of that, so.
Yeah.
That's kind of, like I said, these all look like very nice ideas, and I think they're all great. I just I don't see how we're going to implement them without,
It's going to take support from other departments, from the select board, from other organizations. This is not something that the health department can tackle on its own, and I think that's what
Yeah.
Nicole's trying to relay through this action plan, is that we have the little items that we can tick off, and then the ones that are a little bit more transitional, that take a little bit more time, and we need commitment from other players to
Yeah.
make happen. And then you have the bigger, you know, national issues that are gonna take a lot more change than I think we can do, even possibly at a local level, but we,
is there anything that you can provide that the other towns have been doing that would be of help as far as how they're going about this?
so I think the other communities that participated in the Lower Cape Public Health Needs Assessment did not follow up further with doing this. We were kind of the ones to start to say, we have this information, we've identified these needs, but what can we do about it?
Oh, all right.
So we're kind of the
I
kick off
think
with
that
that.
the presentation last month through the VNA was excellent.
Mhm.
And I think that did show a lot of
Just
community
speak into the
support.
microphone a little better.
It did show a lot of, community support through the, I thought that was an excellent presentation.
Yeah.
So,
Mhm.
Okay,
And just things like that, bringing the information to the board meetings, trying to get our partners up here and to talk about the services they offer. That's been another avenue that we've tried to take to inform the board of things that are out there, as well as the community, and we hope more people watch and pay attention,
Yeah.
so,
all right. Just kind of trying to bring this out in the open.
yeah.
Okay. All right.
Minutes of the
Lose Nicole?
previous meeting?
Was she finished? Oh, okay. All right.
Well, thank you, Nicole, very much for your time, if we didn't lose you, did we?
I think we lost her.
I think we might have lost her.
Okay.
Did we lose everybody, Caleb? Should we wait for a minute?
The internet connection has been pretty spotty, sorry about that.
It's okay. So if we want to hold off until we have the meeting back up and running, I think it's,
Okay, let me just restart this laptop. You guys can continue.
okay. I don't know if there was anybody online that wanted to participate in any of the upcoming discussion.
Do we have like a copy of the minutes?
No, so I noted that
It was gonna be,
it'll be for next month. for
okay,
next month.
that's with, yeah.
Sorry about the delay.
I think that's the first time we've had that issue.
Mhm.
Interesting.
And we'll just make note too that the applicant for, under the Old Finish business, did not notify abutters, so we won't be hearing that. So when we read that in, we'll just let them know that that'll be continued again until,
I was also thinking that for next month, that maybe we should be re-looking at the variance request for this dog-friendly space. There's been a lot of
I
comments.
think there might have been some people
Oh.
online that were interested in that discussion, so you might want to wait.
All
And I
right.
think that we have two, so we have the approval, and then we have whether a butter notification is needed.
All right.
And Nicole, I don't know if you're still there. I think we lost you for a minute.
I am. I did
Okay.
miss the last couple minutes of conversation, though.
No.
I'm sorry.
That's okay. Just wanted to thank you again for your time and all of the
Yes.
work that you put into this.
Yes, great. It was great work.
Oh, absolutely. The town of Harwich is a special place, and y'all are lucky to have Carrie there, who really cares so much about wanting to have an impact in the community. So thank you all for letting me in and for giving me time tonight.
Thank you.
Thank you.
Okay.
So I think you can skip the minutes,
Yeah,
because
skip
we
the
don't have
minutes.
any. And we have to continue old business because we did not receive a butter notification, so the continued variance request for the dog-friendly space for 545 Route 28 will be continued.
But I would like to bring back for the next meeting, which you're gonna chair, is actually looking at that variance request, like re-looking at it. I know we approved it, but I think
Like
with
the
some,
whole process, I
the whole
think.
process needs to be, I think, re-looked at. Just the fact that there's more people now that are aware of what it is, that maybe we need to reconsider some of this. So I'm asking to bring it back.
Okay. I mean, dogs are gonna be allowed in restaurants if they're service dogs, no matter what. We can't do anything about that. I think the guidelines that we proposed and agreed on are fantastic if they're followed. I mean, I don't see why there's any issues. People who are totally up in arms about this have the right not to go to those businesses if they want. And I think the business owners understand that and are taking that into account when they apply for the variance in the first place.
I think that the thought process might be to give everybody the opportunity to speak on this, and if the board still feels, just because it didn't get a lot of attention before, and now it seems to be getting some attention, so allow people to provide some input.
And it might change the way we think.
I think just to give the courtesy to consider what the concerns are, because nobody was aware that we were voting on this 2 months ago. And it didn't come up for discussion with anybody from the public until we actually got our first variance. And with the feedback that we're getting, I think it might be worth opening it up to public comment. You can still move forward with the decision to allow if that's the way the board feels. I would just hear both sides of what people have to say. The restaurants have the ability to come out and speak their piece. The people who are in support can support it. The people who have issues can waive their issues. I think where we're gonna have problems is with people who aren't following. And I know you had some concerns too at the first discussion with playing the devil's advocate. What if the dogs aren't behaving themselves? So I think I see that potentially being an issue if it's not, the dog isn't following our guidelines, that the restaurants could be opening themselves up for a bigger issue than they anticipate. But I think in all fairness, getting everybody back to the table to have a more in-depth discussion wouldn't be a bad idea for the board to consider. But there,
So we're now looking at Parks here, who is here tonight for the second month.
No,
he's
they're
not
not.
here. No, they didn't notify
We got-
about
They
it.
didn't notify the butters. So that's not really on, I mean, it's listed here, but it's,
And we have discussion to talk about a butter notification, whether we feel that's necessary or not. That's on the agenda tonight. But I think more of a discussion on the whole process, we might want to return next month. If
and
all
then,
all of you feel,
and then, and even address the abutters next month as well?
well, if you decide that you don't want to bring this back to the table for discussion and you want to keep it as it is, if you wanted to, if it was unanimous or not unanimous that you don't want to bring it back, I think that's discussion for you guys to have. If you decide you're not going to bring it back, we can talk about the amendment to the variance process.
All right, so I guess I'd like to see it come back next month and discuss the whole issue, so,
I agree.
would you agree?
Well, yeah, I think everybody has to have some input into it.
Yeah.
Um,
I don't think enough people were aware of what was happening.
We're not a very popular board.
The police people,
No problem with that.
First I've heard about dogs in restaurants.
I think it's important,
So, yeah,
because it,
We're an important board, but we're not a popular one.
yes,
well, that's
yeah, there you go.
that's a different
There you go.
story.
So I'm for bringing it back.
I second it.
You are? Kevin?
I don't feel the need to, nay.
Okay, and Janet?
Aye.
Yeah, all right, so 3-1.
Okay, so we'll put it on the agenda
Yes.
for further discussion again next month before we allow any applicants to
Yeah.
apply.
All right.
And then that will null out one of the items in new business.
How will you dissipate the information out?
Well, it goes out, it gets posted on our agenda.
Okay,
We have our Facebook page that we,
okay.
we can start posting our minutes, or not our minutes, but our agendas on there as well.
But I think the whole thing with Port brought it out where more people became aware of it.
Right.
And
Yes.
now, all of a sudden, we're getting calls or comments that I think opens it for more discussion.
I'm not voted anyway, so I mean,
All right. All
I
right.
think it, just to hear both sides and to see what the concerns are and
I
to
think
see
it's
what
a- yeah,
what can be provided for a solution.
Yep.
To make people feel more comfortable if there is that solution. I don't think any of these should be guaranteed. I think they should all be looked at with some scrutiny because there are potentials for issues, so.
Any other towns, what are other towns doing?
On the Cape, the only one that I'm aware of is Orleans, but I didn't do a deep dive into what other Cape communities, but I can do that research too,
Yeah,
and
that
see
would be
what other,
handy.
Well, that's
what other
important, I
towns
think,
are.
yeah, because I think, you know,
Yeah.
other than that, we may be the trendsetters.
Yeah, when we did our research, we looked to the city of Boston.
Yeah, okay.
Because that's who had the best documentation, so. But we'll bring that back,
All right,
so we can move on to new business.
okay, go ahead.
Okay, proposed amendment to the variance, wait a minute. Okay, variance request, 18 Bank Street. Increase in habitable square footage.
Yeah, so you can sit down or up to the podium, wherever you're comfortable, and just introduce yourself and.
Standing right here. Peter Macri, 18 Bank Street. So what we're proposing to do is, it's, our property at 18 Bank Street is a multi-dwelling property. There's a main house and a small cottage to the right of it. Last year, we completed renovations of the main house, and it was to dormer the north-facing side of the main house, and we reconfigured the floor plan. And with those changes, we took away 28 square feet of overall habitable square feet in the main house. Now, in the cottage, what we're proposing to do is we want to move the front bedroom to the second story. The reason for that is that the ceilings are very low and dark, and so we're just trying to open up and get some light in. So the intent is to vault the ceiling in the front part of the building, which faces the public parking lot. So we'll vault that from ceiling to floor, add L-shaped stairs that go up to a second story, and then the bedroom that gets relocated would be captured up in the attic space, which we would dormer. So in order to get those changes in and to meet the requirements for a properly sized bedroom, we do increase the habitable square feet of the cottage by 43 square feet. And if you look at the property as a whole, it's a net increase of 15 square feet, if that's helpful to the board. So we're seeking a variance in order to allow for that habitable square foot increase. The footprint of the building will stay precisely the same. 2-bedroom count, 1-bathroom count, no change. Same thing occurred with the house. We have 2 bedrooms in the house and 2 bathrooms there, and that did not change. So just looking back to that variance in 1994, it's really just a fairly small overall net increase in habitable square feet that we're seeking permission from the board. I'm happy to take any questions.
I don't have any on this. Questions from the board? Anybody?
I took a good look at the plans. I mean, we're swapping that front living room, bedroom area for the stairs and moving the bedroom
We
upstairs.
pick up a tiny bit
Making
downstairs.
it an open
Yeah.
floor for the first floor, yeah.
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 No questions?
No questions.
No questions? All right. So, want to read the,
Proposed amendment to variance filing requirements.
Yeah, make a motion.
yeah.
I'll make a motion to accept the proposal,
Variance request.
variance request.
As presented, I guess?
Mhm.
Yeah. Okay,
For 18 Bank Street.
For 18 Bank Street.
second. Vote?
No?
Aye.
Aye.
So
Okay.
4-0, 4 ayes. Okay.
All right. Okay. Now we're down to,
Report of the health director.
Yeah, so I just wanna, we have under new business, the proposed amendment, but we are gonna bring that back, so we can skip over that. And then discombobulated in my packet. Did, I did one, we didn't print it. Is it in your packets? So I'll carry my director's
she handed
update.
it
It was
out.
pretty mild, talking about Masha and what she's working on in the People's Garden and how it's, producing fruit finally. We're getting some harvest from the People's Garden. And we also, have been supplying food continuously through the People's Fridge. So those were kind of the brief updates on just the programs that we're offering.
People's Garden, is that, you're talking about basically the food pantry?
No, so the People's Garden is an initiative that we've created. It's, we have 4 plastic beds and 2 wooden beds over in front of the 204 that we're growing vegetables in and herbs. And then we have a community plot over at the community gardens, a 24 by 24 plot that we're growing tomatoes and eggplant and squash and
So it's not associated with,
not associated with the food pantry. We have the community fridge that's at the community center, and we're using this produce in this program to fill that fridge and get free, fresh produce to those who
who's
need it.
tending that garden?
The staff volunteers, our core member.
that's good.
Yeah,
That's good.
so we're starting to finally build a volunteer base, which is taking some workload off of the department. The conservation agent, Amy Uzowski, and I have been up watering on the weekends, so. We have-
This is right behind the community center?
Nope, this is out in the front yard at the 204 and over at the community gardens on Sisson Road,
204.
the
The
cultural
old
building.
middle school.
Okay.
Sorry, yep, the cultural building.
Okay, that's a cultural center, okay. How big is the garden?
We have a 4 by 12, 2 4 by 12 raised beds and 2 or 4 2 by 4 raised beds, and then a 20 by 24 plot at the community gardens. So,
You're growing tomatoes?
tomatoes, eggplant, radish,
Cucumbers.
carrots, cucumbers, beans. Some of the easy stuff, squash, some a little
How do you keep
tready.
the rabbits out?
AmeriCorps members, by the courtesy of Conservation Department for the community gardens, built a fence. The other beds are raised, so. Yeah, it's been fun. It's been a good program. We're trying to build more education around it to get residents to come out and learn how to garden and be more resilient and do it at home. We want them to be able to support themselves, so.
Great idea.
Okay.
Correspondence,
None.
permits.
All right, to me.
So we got a few event permits for the markets and Port Summer Nights and Harwich Cran Fest. And then 1 utility installer.
I move to accept the permits as listed.
Second,
Oh,
aye.
aye,
Aye.
okay.
Work session. Phase 3A sewer connection.
So for phase 3, and phase 2 was before my time, what the board is allowing now is anybody who has a failed system and is pending connection to the sewer, we're granting internal waivers to be able to wait and connect depending on what the failure criteria for their systems is. So if it's urgent and is requiring frequent pumping and doesn't make sense for the applicant to continue to pump, they will have to upgrade, but then they have the extension that they can apply for, get 10 years out of their system. But for those who are minor failure criteria, things that can be remedied while they wait to connect, rather than incurring the expense to connect, we're granting them waivers to wait until sewer connection is available. So we're asking for the same thing, or getting the board's opinion on whether they feel the same thing is appropriate for Phase 3A, which was just approved at town meeting. And I think we got a timeline for potential construction, which is a little faster than I expected it to be. They're expecting maybe 2 to 3 years for construction to start, and maybe after that, a 2-year hookup, so.
So, 3A is
It's the Great Sands Lake area
in the next area?
So they don't think that's going to start for 2 to 3 years?
for construction, so they gotta get design for
Well, that's what they don't
the
have.
infrastructure, so they don't have design plans yet. So that's what they're moving into next, and then
Yeah.
they'll go out to bid for construction of the system, and then from there, it'll be just, starting construction. I was anticipating this to be like 5 to 7 years out, but the timeline that I got was more like 2 to 3 years before construction may begin. Again, it's construction, so that's a variable. It usually doesn't take faster, it usually takes longer, but
How are they doing now with the, who in Harwich is connected right now? What percentage of the town is connected?
is connected to the sewer.
Yes.
So if Harwich as a whole, we have, out of the 400 and I think 30 sewer connections in Phase 2, we have sent orders to connect to 130 of those folks.
And that's right around off of 39
Yeah, in Phase 2. So those are the only folks who have connected.
right now.
So we still have about 130, but since we sent those order letters out, we've had quite some communication from people who are either in the planning phases still and just haven't applied for a permit, or are really feeling the hardship from it, and you may start to see some of those extensions and hardships in the future months.
Are they on time? And in other words, is this being done on a timely basis, so to speak? In other
Well,
words-
everybody that's in Phase 2 right now that hasn't connected is past due.
Okay.
So that's why we sent the letters out. But most people are responding. I would say we're getting a good response from people who actually have a plan and aren't just, so we're trying to wean people with a plan out before we start to take enforcement, because it all takes time.
Are most of the people that have a plan and haven't done it yet because we don't have enough installers to do it? Or,
Some of that is pushing it out, some of it is just their plans. So we've had a couple of people where the properties are vacant, they're not living there. They have plans to do renovations in the fall, they're holding off until then. That's not a problem with us. They have plans to connect. Other people, they're installers, so we have one property that has, or one property owner that has quite a few in the Phase 2. And their installer is just backed up, so they're just waiting to get them.
all right,
But, yeah, for the most part, people have a plan, or either didn't know about the extension process for the life of the system, so based on the age of the system, they might have installed their septic 5 years ago and didn't know they had to reach out to us to
Yes. so-
have that process approved, so.
all
It's
right.
at least initiated conversation, and we
Yep.
we don't want to penalize people that are moving forward, so.
Yeah, okay. All right, so that was A.
And
So,
sewer use 660 rule.
yep, so this, the board approved last month to consider properties connected to sewer, also allowed IA use, which would give them 660 gallons, or essentially 6 bedrooms per acre instead of 4. Since that approval went out, again, all our things don't get attention until they get approved. But it should be a conversation that we have with wastewater as well as the select board before we start to apply that, because of our IMA with the town of Chatham. So we would like to try to get a joint meeting scheduled with the three boards before we make a final determination on whether we can apply that to sewer-connected properties. So that was just an update, nothing really to discuss, just saying that the department internally is not gonna be practicing that until it's cleared through the other boards.
I would have a question. If they do want to have the three boards, so we would need three people to make it a board. I don't know if that's what you want to go through, go forward with. It would require three of us to be there during the day. You can't, can you get off at all?
Depends, varies on the day.
Yeah, all right. Then you can work that.
Yeah, we'll figure out a time with what works with the other boards.
What is it, once you're connected to the sewer,
Mhm.
okay, what's the approximate cost for the homeowner?
It varies.
You mean the actual connection or after you're connected?
After
After you're
you're
connected.
connected. In other words, right now we get a
Yeah,
water bill.
It metered through the water wastewater
Okay,
department.
so-
I don't
okay,
know
so
what
it's
those
metered
rates
too?
are. Yeah.
Okay, so it's metered too.
Mhm.
Okay, all right.
Mhm.
Okay.
Yep.
I just was unsure how that whole thing worked.
All right. All right, so that comes back too, or has to wait for the,
Yeah, so we'll wait for that. I just wanted to let the board know that even though that was voted on last month, we're gonna pause any application of that. And then we voted for the waivers to be allowed.
Yes.
We didn't vote.
yes.
We didn't vote.
I thought we did.
No, we did
That's
not.
what I was.
You should vote on
Okay.
it.
And maybe
the
ask if there's
waivers in
any-
place, the same
Any
waivers
comments from the
phase two.
public,
I-
if they want to speak on that or anything else? Just listening? Okay.
I think those straightforward waivers that we had in place for phase two should remain in place for phase three. So I move to maintain the waivers that were in place for phase two as we move forward into phase three of connection.
So this would be Phase 3 and then Phase 3A. Because Phase 2, we want people to connect now for Phase 2.
Right.
Yeah.
But the same waivers that were in place, we want to have in place as we
The
move
three-
forward.
three,
for
yeah, okay.
Just
both
wanna
3 and
clarify.
3A, yeah, absolutely.
Okay. I'll second that one. Oh,
Aye.
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 All right.
Okay?
Motion
Motion
to adjourn?
to adjourn.
Seconded.
Vote?
Aye.
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 All right.
Very good.
Okay.
Okay.
Very good.
Well, thank you for joining us.
Absolutely.
Yeah.